Okay, so we're talking about zinc. I love this stuff, man. Amazing mineral. Unfortunately, deficiencies are very common. Zinc is one of the most important minerals for when it comes to the health of the liver. Fatty liver disease, as you know if you've listened to this program, fatty liver disease, or more specifically what they call non-alcoholic fatty liver disease. They got to call it non-alcoholic to distinguish it from the kind of fatty liver disease that you have to drink a lot of alcohol to get. These days, we all have the same kind of fatty liver disease that alcoholics only used to get not that long ago. Thus, the distinction, non-alcoholic fatty liver disease, or NAFLD. This is one of the most, if not the most important health challenges facing Americans, given how important the liver is. In the last few years, maybe the last 20 years or so, it's become a leading cause of death, the fourth leading cause of death, in fact, among Americans aged 45 to 54, superseded only by the big three leading causes of death: heart disease, cancer, and diabetes. Also, in many ways, gratuitous and unnecessary lifestyle diseases. What does that say about our culture when the 3 or 4 leading causes of death are lifestyle related? Not accidents. They're not curses from above. They're choices, basically, lifestyle choices. Heart disease, cancer, and diabetes largely involve lifestyle choices, and so does non-alcoholic fatty liver disease. And even if death doesn't ensue from fatty liver disease, the vast majority of Americans over the age of 40 are dealing with some degree or another of NAFLD, non-alcoholic fatty liver disease. And non-alcoholic fatty liver disease, NAFLD, can be asymptomatic. In other words, you may not know you have it. You may not even know you have a fatty liver until the doctor does your liver panel and says, oh, well, you got a little fatty liver, and oh, that's just normal. But if NAFLD progresses, it can become something called NASH, another acronym disease, non-alcoholic steatohepatitis, I think it is, steatohepatitis, or something along those lines. Fatty liver, just a more dramatic form of fatty liver. NASH, I'll have to check out the acronym on that, non-alcoholic steatohepatitis, I believe, hepatosis or hepatitis. Anyway, that can be symptomatic, NASH. Fatigue, lethargy, jaundice, bloody stools, these are all signs that you may have a progressive form of fatty liver disease. Simply put, the liver processes fats. It's a fat processing structure, and when your liver cells are pooped, when they're tired, when they're toxic, when they're nutritionally deficient, or all three, tired, toxic, and nutritionally deficient, eventually the liver is going to have problems processing fats, and unprocessed fats are going to start to accumulate. Just like at the airport, when you only have 2 or 3 security guards at the security line, eventually the line is going to build up. Same idea. The liver is kind of like your security guard, your body's security guard. It's processing poisons and processing toxins like a security guard processes at the airport, processes flyers, people who are flying. And just like if there's not enough security guards, or the security guards are tired, or they're overworked, and the line's going to start to build up, same thing in the liver. Liver gets tired, liver cells get toxic, the fats start to build up. And that means that our epidemic of fatty liver disease, is as significant as it is also unnecessary. Even though you hear from your medical professionals, it's inevitable, it's normal. It's not inevitable. It's not normal. There's lots you can do to prevent or even reverse fatty liver disease. And you know what? It's not that complicated. It's really all the same things we talk about every day on the bright side. It's all the same things we need to do to keep our body healthy. Again, this is a major pillar of what I call the bright side philosophy. Taking care of the liver is the same as taking care of the bones, taking care of the digestive system, taking care of the skin, taking care of the blood sugar system, or anything else. You don't need a special liver formula. You don't need a special skin formula. You don't need a special anything formula. We need overall health strategies. The same things we talk about on the bright side every day. Doing what we need to do to address liver disease is pretty much the same thing we need to do to address all health issues. That means nutrition, nutritional supplementation, that means diet, that means food, that means mental health strategies, that means emotional health strategies, and that means making sure that we're spiritually correct as well. It's not that complicated. This is why I'm not necessarily a big fan, by the way, of liver flushes and liver detox protocols, which are usually herbal, usually involve plants, usually involve herbal medicine, in my opinion, create more work for the liver to do. herbal effects or medicinal effects. When you use herbs, you're using medicines. Herbs are medicines. Not as toxic, perhaps, but they're still medicines. And they have to be processed by the liver. And if your liver's already stressed out to the point where you got fatty liver disease, it doesn't really make sense, at least to me, to give the liver more work to do. All right, I'm Pharmacist Ben. You're listening to The Bright Side. 855-660-4261 is our number. We'll be back right after this. Don't go away. Let's see, if you're doing a liver cleanse, I don't know, man. I'm just not a big believer in doing liver cleanses because most liver cleanses involve herbs, and most herbs are medicinal. In fact, that's how herbs work. They're medicinal. There's all these, and drug companies are, because this is such a significant factor, non-alcoholic fatty liver disease, or NASH, non-alcoholic steatohepatitis. NASH is a more advanced version of NAFLD. Drug companies, because there's so many people, millions and millions and millions, 100 million people or so, are dealing with some degree of fatty liver. Drug companies are on the lookout. They're on the search for drugs. I don't know how anybody could think that a drug could possibly help somebody who has fatty liver disease. Nonetheless, you're going to start to hear about drugs for fatty liver disease. The latest one is called tesamorelin, or Egrifta, which is a kind of growth hormone type of drug. Medical Express ran an article. This was posted. This was published in the. This came from a press release, actually, from Massachusetts General Hospital. Headline: Drug that reduces abdominal fat in HIV patients may also reduce fat in the liver. And this is a drug. This is a growth hormone type of drug that supposedly helps the liver burn fat. If you got fatty liver disease, folks, you got a toxic liver, and that means you've got sick cells. Whenever you have toxicity in the body, you've got sick cells. All disease is cell disease, and AFLD is no different. All disease is cell disease, and non-alcoholic fatty liver disease is liver cell disease. Liver cells are sick, period. If you have acne, skin cells are sick. If you have osteoporosis, bone cells are sick. If you have diabetes, pancreas cells are sick. If you have Crohn's disease, intestinal cells are sick. If you have Parkinson's disease, brain cells are sick. If you have ALS, nerve cells are sick. If you have myasthenia gravis, you know where I'm going here, muscle cells are sick. It's sick cells, and it doesn't matter what your doctor has named it. When you think about it, it's silly. The name doesn't matter. The area of the body doesn't even matter. What matters is the cells are sick, and the only reason cells get sick is starvation, suffocation, and toxification, which leads to more inflammation. Or which leads to inflammation, I should say, which leads to more suffocation, starvation, and toxification, which leads to more inflammation, and on and on and on we go in this downward spiral of degenerative disease. So what do? Well, first of all, because the liver processes foods, that's largely what it does other things too, of course, but its most important role, or one of its most important roles, is to process food. Eliminating digestive triggers, food intolerances, foods that we're allergic to, is a must. Secondly, because the liver is a major sugar processing organ, keeping our intake of sugar down and refined carbohydrates down and insulin spiking foods down is also extremely important. And AFLD is a great reason to go low carb. Although the liver, of course, processes other nutrients, it processes fats and it processes proteins. So keeping all food intake down is probably a good idea. As a general rule, keeping caloric intake low is a good idea for anti-aging, for any inflammatory health issues, and certainly for any liver issues. So controlling your intake of foods and stabilizing the digestive system, controlling your intake of sugars, and keeping your blood sugar system stable as well. Does it sound like I'm repeating myself? It should, because I say it all the time. By the way, another article from this one from, I love medicalexpress.com, Medical Express with an X, medicalexpress.com. This came out in July. Consuming probiotics for a month helps diminish fat accumulation in the liver, according to a new study. No surprise. Probiotics and good bacteria, along with good, making sure you've got a good diet, and using nutritional supplements for the digestive system is job number one if you're dealing with fatty liver disease. Job number two is making sure you keep your intake of sugar down. Get on the Biolumin Nightly Essence, get on the Sweeties, use your Beyond Tangy Tangerine, keep your caloric intake down. You see, this isn't hard, and it's certainly not a doctor issue. Do we really need a doctor to tell us about probiotics? Do we really need a doctor to make sure that we're not eating lots of sweets, lots of cereals, lots of breads. Do we really need a doctor for any of this? No. Absolutely not. All a doctor can do is medicate you and make you worse. NAFLD is a great reason to control digestion. Make sure you're avoiding foods that you're intolerant to. NAFLD is a great reason to go low carb. It's a great reason to reduce your calories. And if you're on a prescription drug and you have liver disease, you're really asking for trouble. Because just like the liver has to purify herbs, it has to purify drugs as well. Liver detoxification of medications represents, in my opinion, one of the most overlooked and important issues when it comes to drug therapy, when it comes to drug-based medicine that no one talks about. You always hear about side effects. You always hear about adverse reactions, and these are certainly problematic. Side effects and adverse reactions are a leading cause of death. They're a leading cause of hospitalizations. They're a big problem, and I'm not diminishing that, but there's a hidden problem when it comes to drug therapy, and that's just the work the liver has to do that isn't going to show up on your adverse reaction or side effects section of your package insert. It's just business as usual when you take a prescription drug. When you take any drug, when you take aspirin, the liver has to do the work to purify it, and that's not considered a side effect or an adverse reaction, but it can lead to side effects and adverse reactions. And of course, the more drugs we're taking, the greater the problem. And many people are doing the polypharmacy thing where on 2 drugs, 3 drugs, 4 drugs, even up to 10 or 15. Yes, 10 or 15 prescription medications. It's absurd, really. It's crazy. Now, I can't say that there's a lot of doctors who are silly enough to put somebody on that many medications, but a lot of folks are going to multiple doctors. So if you go to Dr. A, he gives you 2 medicines, Dr. B gives you another 2, Dr. C gives you 3 more, all of a sudden you're on 6 or 7 or 8 or 9 medications. Any case, these things aren't going to show up. The processing of drugs and the burden that they represent on the liver isn't necessarily going to show up as a side effect, but logic is going to tell you that it's going to be problematic for the liver. So get off your drugs if you can, and certainly you can if you're using drugs for some kind of chronic long-term issue. All right. Got a few more things to say about zinc in the liver, and then we'll take your phone calls. 855-660-4261 is our number. You're listening to The Bright Side on the Genesis Communication Network. We'll be back right after this. Okay, get your phone calls here in just a sec. Let me see. I was going to tell you. We'll finish up I'll finish up on the next Bright Side episode. Zinc is stored in the liver, very important for liver health, along with vitamin A and essential fatty acids, the ultimate EFAs. It's protective against liver poisoning. If you're on a prescription drug, please use 50 milligrams of zinc a day. It's critical for detoxification. Dr. Sherry Rogers talks about the importance of zinc for detoxification enzymes in many of her books, especially Tired or Toxic, which I highly recommend, especially if you're dealing with some kind of environmental toxicity or chemical sensitivity, or if you just want to stay younger longer and stay healthier longer. Tired or Toxic, and all the Sherry Rogers stuff is real good, but Tired or Toxic is kind of a classic in the world of detoxification, and she's a big believer in using zinc, as I am, in terms of nutritional supplements. It's just tragic that we have to supplement with zinc, but that's just the way it is, as we'll be talking about in the coming days, due to soil depletion of zinc. Soil depletion of minerals is a big problem, but especially significant when it comes to zinc, which is very important for the growth of plants. For the same reason, zinc does the same thing in plants that it does for humans. It helps the plant process sugar. It's important for growth and protein metabolism. It's important for keeping plants healthy, resistant to pesticides and pests as well. We'll cover that on our next Bright Side episode as we continue talking zinc and liver disease, all as it regards prostaglandins. Believe it or not, zinc also is involved in keeping your prostaglandins and signaling molecules healthy. And then we're going to talk about nitric oxide, nitrogen, arginine. That's how this whole conversation started, actually, is we were talking about arginine and how important that is for helping build tissue. There's actually a form of arginine that's associated with zinc, something called zinc arginate, which is a neat nutritional supplement. All right, those are some of the things we'll be talking about in our coming Bright Side episodes. Time to hit our phones. 855-660-4261 is our number. Welcome to the Bright Side. Rick in Michigan. What's up, buddy?
Yeah, hi, Ben.
Hey.
My daughter has a heart problem, mitral valve regurgitation.
Got it. How old's your daughter?
About 22.
Okay.
Go
ahead.
It's a very erratic heartbeat. I mean, constant. I don't think there's a good heartbeat in about, 1 out of 3.
Okay.
So,
All right.
yeah.
Well, first of all, the most important thing to recognize about mitral valve issues, whether prolapse, regurgitation, heart rhythm issues, is it's not really a heart problem, even though it shows up in the heart. And again, this is one of the major ideas of the bright side philosophy. Our problem isn't necessarily our problem. In other words, where we see the problem is just where we see it, but that's not where the problem is caused. And you can't fix a problem by fixing where it's seen. You got to fix where it's caused. You go to your doctor, or even unfortunately, some alternative practitioners, unfortunately, because they should know better, they're going to treat the symptom. They're going to treat where your sign of your disease is. They're going to treat the mitral valve issue. Well,
they want to do an ablation.
That's disgusting. They should go to jail. Dr. Wallach, he's a funny guy, and he sort of is lighthearted about a lot of this stuff. And one of the things he says when he does his talks, and always cracks me up, he goes, "Somebody ought to go to jail," And if you don't know what's going on with doctors and with health, you think maybe Dr. Wallach's exaggerating. He's not, and I feel the same way. Cardiac ablation, or any ablation, is destruction. That's what ablation means. Now, who in their right mind thinks destroying the heart? Listen, you guys, Rick, you're not a medical professional, right? You're a layperson. You're just an average guy. Do you think it's ever makes any sense to destroy the heart in any way, shape, or form? Now, drugs will poison it. The beta blockers poison the heart, but an ablation is literally killing it. I'm not exaggerating. They shoot an electrical current through your heart. This is the idiocy. They shoot an electrical current through the heart and they cauterize it. They burn it. Well, they burn the heart.
Absolutely, but here's the problem. I tell her not to do it, and I try to get her on supplements and things like that, and she sees it on, my wife sees it on some show that some lady got it and it fixed her life, and all these and we have medical people in our family, and they believe that it works, and they're saying, "Oh, this is great, you should get it." There's so much pressure on her.
Well, look, I can't help you with the pressure. That's between you and your daughter. That's and I know I'm not marginalizing that. That's important, because you're right. They see it on Dr. Phil and Dr. Oz and Dr. this and Dr. that, and you got the medical professionals and they're hypnotized. But just let's use some common sense. Why would anybody cauterize the heart? This is the most incredible. It's ridiculous. But it's more than ridiculous. It's evil. It's criminal. Yeah. And your daughter's not at fault. Your wife's not at fault. But your boneheaded medical professionals are. I want you, Rick, if you want to get these people in your family on the phone, I'd like to just talk to them in front of everybody and ask them, how dare they even think, even remotely consider ablating and read that as destroying or cauterizing the heart to deal with a mitral valve issue. So what do? Well, mitral valve issues, conductivity issues, electrical conduction in the heart, rhythm issues are a classic, capital C, classic sign of a body in distress, of a hyperactive stress nervous system. So what do? You calm the body down, and there's many ways to do it. First of all, oxygen's probably the most important strategy for calming the body down. That means deep breathing. Slow, deep breathing. Sit on the couch, or have your daughter sit on the couch and practice slow, deep breathing, in through the nose, out through the, I say it all the time. I don't want to bore anybody, but it's important. In through the nose, out through the nose. Slowly is the key here. If you do too fast, you freak the body out and you cause more problems. So slowly is the key. Belly out on the inhale, belly in on the exhale. Get an app called BioBreathing or MyCalmBeat. Job number 1 for all conductivity issues. Job number 1 is to deep breathe. And there's a couple more things, so hang tight. Don't go away, Rick. If you're on hold, you stay there. We'll get to you when we come back from our break. 855-660-4261 is our number. I'm Pharmacist Ben. We'll be back right after this. All right, we are back on the bright side talking to Rick in Michigan. Rick, calm the body down. That's what you do for mitral valve prolapse, mitral valve regurgitation, arrhythmias. Any kind of electrical conductivity issue needs to be regarded as an activated sympathetic nervous, signs of an activated sympathetic or stress nervous system. Calm the body down. Number 1, with oxygen and deep breathing. Number 2, by helping the body metabolize sugar, or better better yet, keeping sugar intake down. That means in addition to not eating the insulin spiking foods, the fruit juices and the desserts and the breads and the pastas, using your sweeties, making sure you're getting copious, generous amounts of the B complex, which are your major electrical vitamins. Of course, the Beyond Tangy Tangerine is the best way to go there. Rick, have your daughter sipping on the Beyond Tangy Tangerine in addition to using the sweeties after all her meals. Omega fats are also incredibly important for the heart. That's the ultimate EFAs. You'll get all that in the Healthy Start Pack. And magnesium is also probably the most important heart mineral. And also very calming to the body. Magnesium deficiency along with zinc deficiency are the two most common mineral deficiencies, especially for women, because women will lose magnesium in their blood every month when they have their periods. So it's not uncommon. And I'll bet you, Rick, if you notice that if you pay attention, you'll notice that her heart arrhythmias are worse right before she has her period or right during her period. And that's because of mineral deficiencies as well as changes in hormones. So lots you could do, but number one, oxygen. Number two, sugar, stabilizing sugar metabolism by keeping sugar intake low, using the sweeties, and then also the Healthy Start Pack for the Beyond Tangy, Ultimate EFAs, and Beyond OsteoFX. Anything else, buddy?
How much magnesium do you think she should?
Anywhere from 2,000 to 3,000 milligrams a day is a good place to be. That's what I'd be doing, especially before bed. Yeah, if you're not doing that, if sometimes people only do 500 or 1,000, that might not be enough, especially if she's eating a lot of sugar.
Okay.
Okay, buddy, got to move on. Thanks you so much. God bless you, bro. I hope that works out for you. Steve in Virginia, what's going on, bud?
Hello, thank you. Yeah, I had a couple questions. One just was concerning the schedule. I didn't quite catch the schedule earlier. You mentioned, as far as
my schedule. I'm going to be I'll be in Hot Springs, Arkansas this week. I'll be there doing a talk in Oaklawn. At some bathhouse down there. I'm not sure where it is, but if you get on the website, brightsideben.com, it'll give you more information. I'll be in Hot Springs on Thursday night, and then I'll be next week, or not next week, but the following week, October 21st, I'll be in Olean, New York for my friend Jonathan Smith. And then the last week in October, which is October the 27th, I'll be in Tulsa, Oklahoma. I'm looking forward to that.
Yeah, the one in New York, would that be an opportunity to speak with you, or what type of setting would
yes. I'll make sure I spend as much time as I need to speak to everybody. Absolutely. That's one thing, I can't really give you guys the amount of attention I want on the radio program because I get so many phone calls and we don't have a lot of time. But in person, I'll spend as much time as we need, and we'll get everything done. Okay. There's no rush when I'm in person.
The details on that, the times and places and details, we can get that from the website?
Yes, sir. brightsideben.com.
Oh, okay. And I just had one question, health-related.
Sure.
My oldest son, he, let's see. Oh, yeah. I had it on a paper here. He sometimes has this sleep apnea.
Okay.
And he said the doctor told him it had to do with some weight gain, which
here's the thing about that. It's associated with weight gain, but it's not caused by weight gain, in my opinion. It's associated with weight gain in the sense that when we have weight gain, typically that involves some kind of burden on the body. That means the thyroid is starting to slow down, or the adrenal glands are somehow stressed, and everything's kind of slowing down in response to this burden on the body. So sleep apnea needs to be regarded as the same thing that causes everything else. It's associated with diabetes, it's associated with obesity, but it's not necessarily caused by obesity and diabetes. It's caused by the same thing that causes the obesity and the diabetes, which is, number one, problems with how the body handles sugar, and number two, problems with the digestive system. Those are the two major burdens on the body. Deep breathing and oxygenation are also going to be involved. So what do you do for sleep apnea? Same thing you do for arrhythmias, and as we were talking to Rick earlier, calm the body down using nutritional supplements, especially, by the way, magnesium, which is very important not only for relaxation but also for sugar control. Get on the Beyond OsteoFX and take a little magnesium before bed. That will help. In fact, calcium and magnesium together before bed sometimes helps folks who have sleep apnea. You can use a little GABA, G-A-B-A, also before you go to bed. That can also be helpful. And then if there's any kind of digestive health issues, those need to be addressed as well. Usually folks who have sleep apnea have other health issues. You can't address sleep apnea by itself because that's not the problem. That's the sign of the problem. But you can go behind the sleep apnea and deal with all the things that cause the bodily distress. And I guarantee you, Steve, in addition to your son having a weight issue, I assume he does, he probably has other things going on. He's probably got blood sugar problems, and he may have some autoimmune issues and other inflammatory issues. So control, work at the locus of control, where you have control, which is the digestive system, the blood sugar system, and working with oxygenation. If you control all three factors, not only will your boy lose weight, but he's also going to improve his ability to get a good night's sleep and improve the sleep apnea as well. Digestion, blood sugar, oxygen. Deep breathing techniques, sweeties, keeping your intake of sugar down, using the Beyond Tangy Tangerine and the Healthy Start Pack, and then focusing on eliminating problem foods, and then using probiotics, digestive enzymes, all the things we talk about for dealing with digestive health. Okay?
Okay, thank you.
Thank you, my friend. God bless. Okay, Jasmine in California, what's going on? How you doing? Jasmine. No, Jasmine? Going once, twice?
Yes.
Hey, Jasmine. Hey, what's up?
Okay, I had a question regarding a kidney infection.
Okay, for you? Or somebody you know? Okay, kidney. Okay, go ahead.
Yeah, I have like a severe pain, like a pressure on my lower back on the right side. And I know this may be a little, off topic, but I have like slight urine in the, blood in the urine.
Yeah.
And anyways, I was prescribed ciprofloxacin, and like for some reason I definitely am like real hesitant to take that. So my question would be, do you think that could be something I would take for inconclusive results after blood work, a CT scan, and a urine sample, or do you think I should just go with the colloidal silver?
Well, here's the deal. You don't really want to mess around with an infection. So if you got ciprofloxacin or Cipro, that's something you might want to think about using. Now, I don't know how bad your kidney infection is. Kidney infections are a type of urinary tract infection, so it's not unusual that you have some blood in the urine, but it does sound like it's kind of severe. Personally, depending on the severity, I would probably take the Cipro. If you have a kidney infection, you're sure it's a kidney infection, you don't want to mess around with it. You can have complications, kidney damage, sepsis, or blood poisoning. It can be a big problem. So antibiotics, I don't like drugs. I hate drugs. I'm a pharmacist. I studied drugs for many years, and I hate them. However, antibiotics and pain pills, sometimes there's a need for them. Sometimes you need antibiotics and sometimes you need pain pills. So I'm not Pollyannish about this. There are times when you need these things, and you're going to have to decide that for yourself. But personally, I wouldn't be messing around with my kidneys. Now, if you have chronic urinary tract infections, if it happens over and over again, then you're going to have to deal with the causes. In fact, you should always really be dealing with the causes. And it's usually the bacteria called E. coli, which I'm sure you've heard of. Most people have heard of E. coli. And that typically means, again, surprise, surprise, there's an imbalance in the bacteria in the digestive tract. It's a digestive issue. If it's happening over and over and over again, look to food allergies and looking to correcting the digestive issues, eliminating problem foods, and then using all of the nutrients, especially probiotics, especially good bacteria. That means the Biolumin Nightly Essence, which is my favorite, all-time favorite probiotic. Everybody needs it. Every human being needs the Biolumin Nightly Essence. For you guys selling longevity products, how cool is it that we provide people with products that every human being needs? The Beyond Tangy Tangerine, the Beyond Osteo FX, and the Ultimate EFAs, and the Biolumin Nightly Essence. Get on the Biolumin Nightly Essence. Start eating some fermented foods. See if you can link your kidney disease or your UTIs, if you're getting UTIs, see if you can link those up to specific foods, and see if you notice that you have digestive health issues, because those are great clues for you. Linking, if you can associate your symptoms to foods, or if you have digestive issues, loose stools, diarrhea, bloating, cramping, all of those are wonderful clues for you to really eliminating the problem. Not just superficially eliminating the problem, or not just eliminating the superficial symptoms, but really getting to the cause of the problem. And that's really what it's all about. And thanks for your call, Jasmine. That's all the time we have for today on The Bright Side. If we left you on hold, I apologize. Give us a call on our next episode and tell our call screener we left you on hold. I'm Pharmacist Ben. Check out my website, brightsideben.com. Love to have you on the Brightside Ben team. Click on the Join the Team link at brightsideben.com. That's all the time we have for today. Have yourselves a wonderful, awesome, spectacular day. I'm Pharmacist Ben. We'll talk to y'all later, folks. Bye for now.